Welcome. This is another course offered by Loftus Health. Today we're going to be talking about the 10 rules of physician engagement, and we're going to start this off by going through the objectives of this particular course, and then we'll go into the details of each of these in the further sections. So first off, the thing that we really want to cover is talking about physician engagement in terms of a definition, because a lot of times what happens is we don't always have a great definition, or at least a great working definition of physician engagement, and that creates part of the confusion around this phrase. So we're also going to discuss why physician engagement is important. A lot of times it's, well, why is it just physicians? Isn't engagement important for everybody? And it definitely is, there's no doubt about it. But I think sometimes people really struggle with the aspect of physician engagement, and particularly that target audience. And so that's why we're talking about that particular target audience today. We're also going to learn how what we say and do can create physician disengagement. And as you'll learn in this course, disengagement is actually more important than engagement. I know that sounds kind of contrarian to what I'm proposing in terms of the title, but you have to when we go into it, we'll explain why that's actually the key driver of engagement. And then lastly, to learn what you can start doing today that will promote physician engagement. And I would say start promoting engagement of all people that you work with and are associated with in your healthcare system. So let's go into this idea of what engagement is. And I got this from Tim Rutledge's Getting Engaged, the New Workplace Loyalty. And Tim describes it as a person who's fully involved in and enthusiastic about his or her work. Truly engaged employees are attracted to, inspired by the work. That is, I want to do this. They're committed. I am dedicated to the success of what I'm doing, and they're fascinated. I love what I'm doing. When I was in clinical practice, every single day I would, no matter whether it was a good day or a bad day, I still ended up at the end of the day saying I love what I'm doing, and I think that's true for what I do right now. But the idea is that you get up, you go to work, and you enjoy what it is that you're looking at every single day. So I think most people would say, yeah, that's exactly what I mean by engagement when you talk to individuals. But that's not always true. So I'm going to propose something here, and I'm going to redefine physician engagement. And I think it's necessary to do that. But I'm not going to completely give up on Tim's definition, because I think that's spot on for most people. But let me just tell you about a discussion I had one time with one of our senior managers, and I said, "What do you when you say physician engagement? What exactly do you mean?" And this is pretty much the response I got: a physician who does what administration wants them to do. And I kind of smiled, and I could tell that the person who gave me that definition was not smiling and didn't think it was a joke, and said, "No, really, that's exactly what I mean by it." And I thought, well, that's not very realistic, because that's if you went to 100 physicians and asked them if they think that that's what physician engagement means, they would laugh in your face. So we have to come up with something different. And really what I found out is that when people say that particularly someone in administration says, it's getting physicians to do what we want them to do, it's not necessarily true. In fact, actually most administrators and most people in senior management don't hold that opinion. It's just that, unfortunately, this is a prevailing perception out there that they all do, and they really don't. So what I want to do is in order to have this discussion, we have to have a definition. And so I'm going to propose a definition, and then I'm going to come back a little bit later in the course, and I'm going to reword this definition. So if you don't like the way it's worded, don't worry about it. I'm going to wordsmith it later. But I want to be able to put something out there just so that we have a working definition as we start this. So how about this one? A physician who is fully involved and enthusiastic about his or her work and is actively participating in improving the clinical, operational, and financial conditions of the healthcare environment in which they function, as well as the overall customer, that is patient, and staff experience. It's a little wordy, and I'm gonna edit it down a little bit in a few slides, but I wanted you to see this because it's important for us to start with a working definition. That's how we get a lot of our misconceptions around physician engagement. We don't actually have a definition for it. In fact, actually, I took that same question to a number of people in administration, both administrators and physician executives, and asked that same question. And what I found was everybody was all for it. Everybody likes that idea of physician engagement and supports it. But when you ask them specifically what they mean by it, everybody has a slightly different definition. So we have to begin with the definition. That's the first thing. And it has to be a definition that everybody agrees on. So hospital administration has to agree on it, physicians have to agree on it, nursing has to agree on it, everybody has to be able to sit down at that table and go, that's what we mean by physician engagement. So I'm putting out a definition. I'm sure there's plenty of others out there, but in order for this course to proceed, we have to start with one definition and work from that. So if you have any further questions, you can always, as you'll see, I'm going to end each slide, each section with this same slide. You can always contact me at terryloftusmd@gmail.com or visit my website, loftushealth.com. Each section will have this on here, so don't worry, you'll be able to see this again. And I'll try not to make it too redundant at the end of each section. Until then, we're moving on to the next section. We're going to talk about why this is important.